let's just start. Well, just just a little ID, who you are, where you work, what your position is.
Okay, sure. So my name is Shelly Griffith. I'm the CEO at Ebenezer Lutheran Care Center. We're located in Brush, Colorado. We are a continuing care retirement community offering all levels of care and have been in existence since 1903.
You've been in this position for a pretty long time now, right?
I have been the CEO since March of 2012, and I began employment with Ebenezer in July of 2005 as the Chief Financial Officer.
Okay. How many residents do you have?
Our campus today has around 150.
Mm-hmm.
Oh, maybe that's not right. About 170.
Mm.
Yeah.
And that's today. How many did you have just before the pandemic started?
We were closer to 195.
Mm. And the 25 or so that aren't there anymore. Well, first of all, have you gotten any new admissions?
Yes, absolutely. Yep, we began taking new admissions back in July, I believe it was.
Mm-hmm.
Yeah, for a period of time, we were not able to take any admissions because we had positive cases of COVID on the campus.
Mm-hmm.
And then since then, we have been admitting and discharging people back home, just like we would before. It's just taking us a little bit longer to rebuild that census right now.
Mm-hmm.
Part of that is due to some hesitations from people wanting to enter senior living during this time. There's some concerns. Mm-hmm. There's some wanting to protect. Right now, if you come into our community, we would have to quarantine you for 14 days. And there are families who are just hesitant to do that currently and just keeping mom or dad at home as long as possible.
Mm-hmm. And quarantining means in your room, you don't leave.
That's correct. Yes. And anybody who comes into your room is wearing full PPE, face shields. Meals have to be ate in that room, not allowed to have any visitors in your room, not able to leave really for any reason unless it's a medical need.
That must mean a huge challenge for the people.
Terrible challenge.
Who,
I think people who are living in senior living right now in senior living communities have a lot of challenges. They, as a whole, we have to isolate or the better term is we have to reduce the number of group activities that we're doing because we have to accommodate the 6 feet social distancing in every aspect of their life. If the individual is in quarantine, they don't have those options, so they need to remain in their room. It became challenging for them to keep up relationships with their families, getting comfortable, getting acclimated to a new space. So it's very difficult for an elder this time.
What sorts of measures have you taken to try to, for the people who are both new admissions who might be quarantined, but also for anybody, just to ease the isolation? What have you been able to do?
Our team is working with a variety of different technology to help people keep those relationships occurring outside of the walls of the campus here. Our activity team has become very creative and ingenuitive with some one-on-one activities, and they're taking different activities into the individual so they can participate and stay busy with different things dependent on what their interests are. As far as communicating with people outside of our community, we're using tablets and laptops. So we have what's called an IN2L machine that they can FaceTime, Skype. We're doing Zoom meetings so that we can have those conversations continue and have that engagement continue. A lot of music is happening in people's rooms. Music is helpful and healthy for people to, continue to, it just brings, I guess, peace and comfort to people. There's in some situations, if they are not in the 14-day quarantine, we can do outdoor visitation if things align. Right now, our community is not able to do that because we had a team member who had tested positive a few weeks ago. Fortunately, no symptoms. She feels great. But because of that, we needed to stop our outdoor visits until we go 14 days without any cases, which we're right on the brink of. Hopefully this next week we'll be able to start doing those again. So utilizing technology, using phone calls, window visits, so people can come see mom outside the window, but we have to make sure that those windows are closed so that we can protect everybody involved.
You mentioned some kind of a machine for what is that called?
Yep, it's an IN2L. IN2L stands for It's Never Too Late. It's a big computer screen on wheels, and it's very interactive. So we can use that to accommodate a Skype or a FaceTime. We can also use it to play games. So if somebody wanted to play a game like Family Feud, they would be able to set the game up in their room, and then the neighbor would be able to touch screen and play the game. Scrabble, variety of different board games. If there's, maybe they want to take a bike ride through a country, it simulates that type of a ride through the country or through the city or along the beach. There's just very, very many opportunities to provide some activity or some social stimulation for people.
And how's that been accepted? Do the
pretty well? It's a technology that we were using in our community prior. So the people who were with us prior to COVID were somewhat used to it. Dependent on what that individual's cognition is, they may be able to navigate it well. It may take one of our team members to help them navigate it. Our assisted living population is able to navigate it pretty well.
What other sorts of activities have you been able to bring to patients' rooms or residents' rooms?
My goodness. So we've been able to do a series of things in the hallways. Hallway bingo is what we called it. People would come to their doorways, they would get their table and their bingo cards, and our activity personnel would call out the numbers down the hallway. Their doors are that 6 feet apart. They're staggered, so we're able to accommodate all the way down. We've done hallway bingo or hallway bowling. We've done dance contests in the hallway, which is primarily our team dancing, but our neighbors can dance from within their doors. So those are some of the things that have happened. We've had people come around the outside of the campus to sing and do that sort of thing to help provide another form of activity. Our church has a closed circuit television system. And we've been able to use that to do like yoga. We can perform yoga in the church, and then that's broadcast throughout the campus, and anyone who turns to that channel can participate in their own room. We've done a series of Bible studies that way. It's not very interactive, of course, because it's not two-way communication. I don't know where I cut off, but so our chaplain is able to.
Chaplain.
Yep, she's able to read Bible passages from the church, and she's able to ask some questions.
All right. So how's morale, both residents and staff?
We were then sharing that information out to our team, which was somewhat frustrating because they were getting different messages throughout the day. But at the same time, the team knew what they needed to do, and they hung in there. They did all the things that we never thought we would be doing in senior living. And we had tough days, but people got through it. So now the morale, I think, is much better. I know that our team has incurred quite a bit of loss during the month of April into May a little bit. That was challenging, difficult trauma for us all to go through. Everybody deals with that stuff differently. But where we're at today is people are understanding that this is not going away anytime soon. And so we need to continue doing what we're doing and doing our jobs 100%. accurate 100% of the time, which doesn't seem possible because we're human, but at the same time, that's what the expectation is because this virus is so virulent. As far as our neighbors, they're having a difficult time. They're not understanding fully why they are not able to see their families, why their families can't come in and to our buildings to see them, why they can't just leave and go to things that they want to go without having any other quarantine or isolation that they would have to do after their return. So
you said that the staff, especially around April, was mourning loss. Are you talking about residents who had died?
Right. Yes. Yeah, it was a difficult time. Our community experienced a significant amount of people who became infected with the virus. And while we had many more recover than we had pass away, we had a fair number of people who did pass away from the virus. We had one team member who was hospitalized.
Can you share how many people were infected and how many died?
As far as how many people, we had 22 people who passed away, neighbors. Wow. And we had another 52, something like that, who were tested positive or presumed to be positive, who fully recovered.
And this was, you said, around March or April, so it was early in the course of the pandemic.
It was April was our first confirmed case.
And how long did the
It was about 5 weeks.
About 5 weeks. So those must have just been hell.
They were very difficult times. As a community, we stood up our incident command system March 9th at the beginning of what we foresaw as the virus coming into the community. And when I talk about community, I'm talking about Morgan County. And as a team, I felt like we had so many things in place. We were trying to stock up on our PPE. We were trying to establish emergency preparedness things that we didn't already have in place, but things that we could guesstimate we may need to have in the future. Just going through all of those things, trying to scenario plan what we needed to be prepared. No idea. We had no idea we were going to be affected like we were.
And you said it was March 9th you set up this
incident command.
Incident command. And when did your first case
arise? Our first case was April 5th.
Okay, so you had a month.
We did. Yeah. And so what happened as we started having, that case, the cases then started building very quickly. And as a community, as most senior living communities across the country, we did not have the PPE available to us like we needed. And prior to that case, I began reaching out to our local health department to get additional PPE supplies. And they had deemed nursing homes as a tier 2. Hospitals and emergency responders were deemed tier 1. And basically they said, you're tier 2, you're not going to get these supplies until you have an outbreak. And of course, my response back was that will be too late. And that's exactly what it was. It was too late. We did not have the adequate PPE to help protect our team and help protect our neighbors. And the virus came in from what we have determined to be through an asymptomatic individual. And that virus just spread quicker than we could get on top of it. Once it's in the building, it's impossible. And especially at that time when we did not have the adequate supplies that we needed. Now, as a community, because so much knowledge has been brought forward throughout the entire country, we have so much more PPE available to us, and we have a much larger stockpile of it.
Besides PPE, what were your greatest challenges early in the pandemic?
Yeah, our biggest challenges were the information coming to us from both the federal regulators and the state regulators were not consistent. We would have the federal CMS stating one thing, Colorado Department of Health stating another thing. The information that was coming was very vague. It was very difficult for us to navigate. CDC was throwing in information. We were just getting this information from so many different organizations that was difficult to determine who trumped who and what was the guidance that we really should be adhering to. So it took us just going through all of that. We ended up breaking things down and putting individuals responsible for any kind of new CDC guidance and putting someone in charge of anything that comes from the state. And we were meeting every single day. And sometimes those meetings would be upwards of 2 hours just so that we could filter through the information, try to make sense of it, and then pivot and adjust and get our team educated on what those new rules were.
Mm-hmm. And Ebenezer is freestanding, right? You're not part of any system, because what I've heard from people who work in other places is that they've had sort of the central command of their system. There's a medical director or a team that is now they're saying, here's what you follow. They filter it all for you. So you guys had to do this yourself.
We did, and as we were experiencing some of this information and trying to interpret it, we were reaching out to those state organizations, and unfortunately they were just not able to provide us any more information that we had, and they were not able to provide us any clarification, which was frustrating. And so we were trying to do the very best we could with the information we had available. And as we got through that pandemic, I reflected back on those days and those decisions that were being made at the time the decisions were being made. And as an organization, I full-heartedly believe that we made the best decisions we could with the information and the resources we had available to us at the time.
Do you have regrets?
I can't say that I have regrets. Am I frustrated? Absolutely. But I can't say that I have regrets because, as I just said, as an organization, we were making the best decisions that we had at the time with the information and the resources we had available to us. Now we know more, and so we're doing things differently. And as an entire country, as an entire world, we know more, we're doing things differently. But as I looked back on those things, I don't know how we could have made different decisions at the time.
So what sorts of practices have you changed as time has gone on?
Well, as supplies became more readily available, everybody who is providing direct patient care or who has any kind of interaction with a neighbor is in a procedure mask. Anybody who is doing that is also wearing eye protection. If at this first onset of any type of a condition or symptom, we are taking full precautions. Any of our staff that are exhibiting any kinds of symptoms, we're taking those seriously, and they're not coming to work until those symptoms have alleviated. That is one of the things that, as we look back on it, the information that came to us at the onset back in March, it was the symptoms were a fever, a new or worsening cough, or shortness of breath. Those were the three symptoms. As we got into July, that symptom list grew to about 10, all the way to fatigue, sore throat, headache, nausea, vomiting, many things. And so there were, at the onset, we potentially had staff who had some of those symptoms, but didn't even know that was a symptom to COVID.
How is your screening situation? Or your testing situation? Do you have adequate tests? And are you screening regularly asymptomatic staff or residents?
Anybody who comes into our community is screened. We have 3 screening locations on the campus. So regardless of what you are doing on the campus, if you are coming into our building, you are being screened. And then there's that series of questions that I just referred to, temperatures being checked. You're signing off that you do not have any of those symptoms and physically marking no to each one of those symptoms. And then we have a team member who is screening you and confirming that you don't have those symptoms and physically taking your temperature. As far as testing, we are testing everybody on our campus every 2 weeks. If we have a positive case, that kicks us into a weekly testing. And if our positivity rate changes in our county, that could take us up to 2 times per week of testing. Right now, we are testing every 2 weeks, and the care center is going through weekly testing due to a positive employee we had 2 weeks ago. Fortunately, everything that's coming in right now has been all negative, so we hope that continues.
Knock on wood. You said you're just a few days away from being able to open up a little again.
Correct. Yep. We're hoping on Monday we can do that again. As far as the costs, the state of Colorado is providing us all of the PCR test kits. They've provided us some supplies, and the testing is being performed at the state lab at no cost to our community. The challenge is the federal government is expecting us to receive results in 48 hours. And the state lab does not have the capacity to turn those around that quickly, and they're being returned anywhere between 5 and 7 days.
And of course, during those 5 or 7 days, you don't know what.
Right. And so during that time, if someone is positive, they continue to shed that virus until we learn that their test was positive. So it takes us tracking the state lab results, 7 days a week. I don't want to say 24 hours a day, but a lot of hours a day. We're checking those state lab results in the middle of the night, because if we do have someone who tests positive and they are to report to work at 6 o'clock that morning, we sure want to catch them before they report to work.
So given that if you just read the news, and I'm no more expert than anybody else, you could still be going through this 6 months or even a year from now until there's a widespread vaccine. How does that feel? Or I guess I'm asking, how's your own mental state through all of this, and what are you doing to hold it together?
It's difficult to continue to keep the energy high for the team. Because being tested every week, every 2 weeks is not comfortable. People don't enjoy that. But at the same time, people are called to work in senior living, and we just keep reiterating that it is a special individual who is doing this work, and really trying to keep people built up and show our appreciation for all that they are doing and complying with, so that they can continue to do this level of care that is so needed. There's no field being affected more than senior living. No field. Nobody's being tested like we are. Nobody is being held to the standards that we are. And so when we have those conversations with staff, we just have to call a spade and be frank about it. And it's what it is.
Have you lost staff over this?
Few. We lost a couple because they needed to care for a family member, but we have not, to my knowledge, we have not lost people because of the additional requirements.
That says so much for the heart of your institution, which I've always appreciated.
Yeah.
How about your family? How is your family doing with all of this? I mean, Mama's inundated with work and worry, and you come home and having been in a place with a potential infection. How's that going?
Yeah, so during at the onset of this, and as we were having our outbreak, we were very conscientious. So me personally, when I would get home, the first thing I would do is I would go shower, take all my clothes off, I'd shower. All those clothes went straight to the washing machine. We had team members who wouldn't even bring their purses inside their house. They wouldn't even bring their shoes inside their house. They were taking all of those levels of precaution to protect their family. For some of our senior staff, they were putting in immense amounts of time. It was not unusual for us to have 15, 16-hour days and go home, try to get some dinner, try to spend some time with your family, and turn around and do it again the next day. And those were 6-7 days a week. But that's just what it was. That's what we had to do. Our community does not have the extra resources. We don't have the extra personnel to help step in and give that relief. We, as an administrative team, we felt very strongly that we had to be here to support our frontline team so that they knew we were in it with them. During that time, our board of directors set up an employee, a critical needs fund. Because keeping in mind, we had employees, we had individuals who were working for us whose spouse may have just been furloughed, or we had spouses or single parents who then had to take on teaching their kids from home and navigating online school and all of those things. Daycares were shutting down, so expenses were escalating. They had so many other external pressures. So our board created a critical needs fund, which they donated to with their personal dollars, that helped to support our employees in the event that they had a utility bill that they couldn't pay, or their rent was due and they were unable to make it because of other COVID extenuating circumstances that just helped the team kind of get through those tough points. We also spent a lot of time and finding people to help support the emotional health of our team. We had individuals who would come on our campus who are licensed social workers and licensed counselors to be available to our team to talk to them at the end of their shift, talk to them during their break, so that they had somebody who wasn't us, somebody who wasn't Ebenezer, to go talk to and kind of unload all of the pressures and stresses that they had. So
Wherever did you find those people? I know from having worked there myself in the same community, they're so few and far between.
They are far and few between. Honestly, one individual, that's what she does for a living, and she travels to other states, but during this time, she was unable to travel. And so she reached out to us and said, what can I do for you? There was a local trauma counselor in Fort Morgan who received a grant to help provide, and she is someone that we have sent our employees to in the past. So we were one of the communities that she reached out to also and said, if you have employees who are needing me, let them know. They can come schedule a time with me and it will be of no cost to them. We worked with our employee assistance program within our health insurance programs, and our chaplain, as well as a couple of other individuals, created this group. There were 3 individuals in our campus that people could just reach out to and share concerns or needs, and those 3 were responsible for helping to go find those resources.
And you say were, I assume it's ongoing.
It is ongoing. The demand is not quite as high, but they're still available to our team.
How about during this time, one of the things, again, that I love about Ebenezer and institutions like Ebenezer is the close relationship with the community itself. Mm-hmm. How's it going with the community? I mean, on the one hand, you could also say, boy, Ebenezer is where this disease is rampant. Yep. We just want to stay away, and why'd they bring it to our community? But so how is it going with the community over this time?
Yeah, so there's kind of 2 facets there. One of them being, if it wasn't for our larger community, I don't know how we would have gotten through what we did. Because we didn't have that PPE, those gowns that we needed, our community went to work and they were making washable gowns for us. We could not buy washable gowns. We couldn't buy disposable gowns. And so they went to work and we received something like 900 washable gowns and hair coverings over the course of 6-7 weeks. And quite honestly, that is what helped us get through to that point where we were able to get those gowns on order or get them in. They were providing us with nourishment, whether it was coffee, pizzas, candy bars, crackers, cookies. There was just shipments just showing up to our campus from various people, many of them anonymously, many of them family members, many businesses. They just knew that our community was getting hard. And was getting hit hard. And when we got through the pandemic or the outbreak, and we got to the point where we started to take admissions again, I had talked to our team about the work that we were going to have to do to rebuild our reputation, that we were going to have to rebuild our credibility within the community. And that was far from the truth. Our community still believed in us. They understood the challenges that we had, and they knew that there was nothing we could have done differently to redirect some of what we encountered. In our community, Morgan County was the heaviest hit community on a per capita basis, outside of Logan County, which was mostly driven by the prison. If you pulled that out, Morgan County was the heaviest hit. And we have a meat processing plant. We have actually 2 meat processing plants. We have a milk processing plant. And those industries were heavily affected as well. And if you think about where our employees live, they're living with those individuals who work in those other areas. So, you know, looking back on all this, we have asymptomatic people that we could not identify because testing was not available. We had people who had exposures that had were showing symptoms that were not determined to be COVID related. All of this stuff that we know now, we did not know in March and April. Mm-hmm. Our community recognized that, and they still believe in what the work that we're doing here.
So how are you sleeping?
Well, if you'd ask my husband, he'd tell you not well.
You're thrashing?
There's a lot to keep you up at night. Yeah. We'll get through this and we'll get to the other side of it. I just don't know when that's going to be, but I've said this numerous times before. If I were to have to go through this again, there's not another team I'd want to walk this path with. This Ebenezer team is full of grit, and they have a lot of capacity, and we are all doing more today than we were doing in February.
That's wonderful that you can say that. So speaking of the team, you have a medical director, of course. Mm-hmm. Has the medical director been involved in this?
She has.
And how
yes.
so?
She's been involved as we had various situations, some of the guidance that was being submitted to us that we were having, that wasn't really clear. We were reaching out to her to get her input and guidance on it. When we got to a point of testing, we were seeking her guidance on who and when and how often. As we had various situations arise with some of our neighbors, she was very, very available. She was always just a phone call away.
I don't know who it is anymore. Is it?
It's Caitlin Ahern.
Oh, okay, sure. Mm-hmm. And is she still also practicing in
Yuma? Yep.
In Yuma, because she was also in Akron for a while. So she's just,
correct. Yep.
Okay.
She's the medical director for Washington County.
And is she doing a number of nursing homes or
just the 2? Yep, just Washington County and Ebenezer.
Okay, and does she? She's not the attending physician though for all.
She is not. No. We the attending physician for the majority of folks living on our campus is Dr. Stats from East Morgan County Hospital, a Banner physician, and then there's a couple 3 other physicians who follow individuals on the campus.
And have they been coming and doing in-person rounds, or are they?
Yes. Yep.
Okay. And do they do it like we used to on everybody at certain intervals, or are they doing more kind of video check-ins?
They have not done video check-ins. We've been working with EMCH on that to see what that would look like if we were to experience another outbreak, which, those are just continuing conversations, but the physicians were in our building. Now, they may not have gone into every room because of the precautions that were in place, but they were still very engaged with the care.
Okay. And for the audience, EMCH is East Morgan County Hospital, which is in Brush. So have you also been collaborating with the hospital in this process, and if so, how?
With the hospital, yes, definitely. When we did our first mass testing of our employees, East Morgan County Hospital was gracious enough to set up for us, and they did all of our testing of our employees. All of the resident testing has been done internally by our team. As far as collaboration with hospitals, we've done that through our emergency service function, the ESF8 committee that was established several years ago. So that's in conjunction with CPMC, EMC, Colorado Plains Medical Center in Fort Morgan, East Morgan County Hospital in Brush, as well as other medical and emergency responders in the area. And then
So this is a regional group?
County. It's a county-wide group.
And it's called what?
It's the ESF8 committee. So ESF8 is something that the state of Colorado put out just to do this, so that we would be prepared in emergencies, and we would have the relationships built with partners so that we could all cooperate and work together in emergency situations. We've done some widespread emergency events over the course of the past few years, which has really been helpful.
You mean just exercises?
Yep. Mm-hmm.
So
yep.
What role has that organization had in this?
Really, it's been a resource role, kind of keeping everybody apprised of what is happening in the area. And then if there's resources that are needed, we would be able to work together locally to get those resources. Mm-hmm. And then there's also a larger group, which is the Healthcare Coalition, which is all of Northeast Colorado, including Weld County and Larimer mm-hmm. County. And so we're part of that. But ultimately, what transpired through some of those calls, when we were in such need of PPE, some of the more outlying hospitals were sending us extra supplies that they had, mm-hmm. which was critical. Yeah. A box of gowns was critical.
Yeah, and it took a long time for a number of these small communities to even have their first case.
Yep.
Now, some of them did
right.
early on, I know, like Kit mm-hmm. Carson, but for the most part, well, that's so good to hear.
Yeah. Yep. Yeah, Morgan County was one of the hardest hit out in this area.
Mm-hmm. Yeah. So, well, let me ask you, what else would you like to say about this? Or are there any questions I haven't asked, or things you'd like to say that you haven't had a chance to?
I guess one of the things is leading up to this time, we knew that as an organization, we needed to be advocating for senior lives and for nursing homes and assisted living providers. And during this time, it became that much more evident that there was just our governments were not prepared. They did not allow communities like ours to be prepared. They did not put us in that top tier. I will never understand why we were not in tier 1. We should have been the highest priority because we are the ones who are caring for the largest volume of the individuals who are most exposed, who are most negatively impacted by this virus. And so I hope that as we move forward through the advocacy and through these through all the conversations that I've had an opportunity to have over the last 5 months, that we become a bigger voice at that table, that when these situations arise, that nursing homes have that seat. Mm-hmm. So we can have that priority.
Maybe this is putting words in your mouth, but you feel like that was reflecting our society's undervaluing of
I do.
Seniors.
Absolutely. Yep. Yeah, there were so many resources directed to our hospital providers, and they have loud voices at those tables. And I'm not saying that they shouldn't have had resources, because they absolutely needed them as well, and appreciate our acute partners throughout the course of this. But at the same time, we don't have the resources that a lot of our hospital partners have. As our assisted living started to have cases, of positive or even symptomatic individuals, assisted living communities do not have the personnel, the capacity to handle this virulent of a virus. And so we were trying to get folks into the hospital so that they could receive that higher level of care. As an elder, this virus can attack quickly. And they can have a sudden change in condition. And if they were in assisted living, our team may not be able to respond as quickly as they would need. So, but it was very difficult for hospitals to take that assisted living community or assisted living resident because they had no way to get paid for them.
Well, let me say that as a family doctor which means that for most of us, and certainly for me, the bulk of my practice is not in a hospital. The hospital-centric nature of our healthcare non-system, is a constant frustration. It's a constant battle to be fought.
Yep. I imagine.
And I think you ran into it very strongly here. But you're doing okay. And is the institution doing okay financially? I mean, I know your census is down 20, which is significant.
Right.
And you have greater expenses with all the PPE and rigmarole. But are you doing okay?
Yeah, as a community, we're doing okay. We were able to get some additional support from both Medicare and the State Department of Health. We applied for a PPP loan, and we were able to get those dollars, which was quite honestly godsends. That's the only thing that helped us get to the point where we're at. Amidst all this, we had construction going on our campus. We got the fourth phase.
Always had construction going on your campus.
Yeah, well, it seems like that for the last 3 years. But we're in the fourth phase.
As long as I've known you.
Yeah, right. So the fourth phase has been going on. And so we've been, handling the construction that's occurring as well as this pandemic. So financially, the organization is probably doing as well or better than a lot of others in our field. But we're an efficient organization. We are very careful with where we're spending our dollars. But as we're moving into our 2021 budget, it's going to be difficult budget discussions because our census is not where it has been historically.
So what do you what do you foresee, let's say in 1 year and in 5 years, what's Ebenezer going to be like and what are you going to be doing?
So in a year, I see that we will be, well, even now, I mean, we're already better prepared to handle something like this, but in a year from now, we'll even be that much more prepared. Our campus is going to be thriving because that's who we are. That's the nature of this organization. We're going to find a way to come out of this. Our census is going to build over time. It's just building slower than where we want it to be. And in 5 years from now, we're going to look back on it and think, wow, that was 5 years ago. And we're going to be at a different point. And we got a lot of development planned on the horizon to really expand the opportunities for people in this area and enhance some of our levels of offering. And so I see that that's going to be either having come to fruition or on the brink of rolling out at that point.
Mm-hmm. And how about you? You still going to be doing this?
Well, I think so. None of us anticipated what this was going to be. And there are many days we all say, what are we doing? But at the same time, I keep reminding our team that if we're not going to be doing it, who is? And this is such a critical need for this community. And our community needs us to continue to do this. So will I still be here? I hope so. I believe wholeheartedly in this community. I believe in what we do. And we have a lot yet to accomplish and offer. So we'll get there. I might have a few more gray hairs, quite a few more wrinkles, but
Well,
we'll get there.
so there, the community is very lucky to have Ebenezer, and it's very lucky to have you. And I so appreciate it. Any other words?
I don't think so.
Okay. I've learned not to say any last words because that really scares people through, especially when I was doing hospice.
Right,
Um,
sure.
this has been terrific, and I so appreciate it.
All right. Well, good to see you. I'm glad everything went well with your move.
Oh yeah, yeah. No, I'm doing swell, and sometime we'll talk about that. But
Yeah. Okay. That's
all right.
yeah. Moving during a pandemic had to be fun.
Oh well, yeah. I just drove straight through and held my breath.
All right. That sounds good.
Thank you very much.
All right. Thank you. You take care.